accepted common sense that in order to treat a disease, you will first need to diagnose it accurately and yes, quickly. However, such commonsensical statements don't seem to apply to persons with tuberculosis. Persons with TB face long delays, high costs of diagnostics, inaccurate testing, and even when they are diagnosed, they are stigmatized for doing so. Diagnosis takes up to 2 months. Drug susceptibility testing is still not the norm, leading to needless treatment failures. An ideal TB diagnostic test is the one that is affordable, accurate, available at point of care, and adheres to WHO guidelines in order to save lives.
The countries must adopt to newer diagnostic tools. For example, the Urine Lamb has been approved by WHO. Which country can adapt and also scale up the interventions? We need to move away from the sputum diagnosis using the gene expert, especially we're looking at PLHIV clients and also pediatric TB. If we want to end TB by 2030, then country must adopt the Urine Lamb, which has been approved by WHO for testing among these community members. We want to end TB by 2030, and therefore we are demanding the scale up of those interventions within countries. We must end TB now.
Most available TB diagnostics run on sputum, but not everyone who seeks TB testing can produce this sample. Children, people living with HIV, and people with presumptive extrapulmonary TB, so TB disease that's outside of the lung, often have difficulty expectorating sputum. Urine Lamb is one alternative non-sputum-based TB diagnostic test. Urine Lamb has moderate accuracy in severely ill adults and children living with HIV and has been shown to save lives, which is why it's recommended by WHO in this population. A presumptive patient only needs to provide a urine sample, and because it's a simple lateral flow assay, the Urine Lamb test can be performed at the point of care. Urine Lamb tests are commercially available, so countries need to scale up their use and take advantage of their life-saving potential.
To end TB, drug resistance testing is a necessary and important step to determine the appropriate and effective treatment for a TB patient. Next generation sequencing, or NGS, can provide drug resistance testing as comprehensive as current culture-based methods, but within a much shorter time frame, so 1 to 2 days instead of 6 to 8 weeks. NGS is a rapid and high-throughput method that allows one to determine the genetic makeup of an organism. It can find changes or mutations in the genome. In the case of TB, NGS can detect mutations that are linked to resistance to different anti-TB drugs. Thus, NGS can be used to diagnose and direct treatment for drug-resistant TB effectively. NGS is also a critical tool for surveillance to track the spread and evolution of a disease, be it SARS-CoV-2 or drug-resistant TB, or indeed any other pathogen.
At the moment, most TB diagnostics are based on a sputum. That's the slime that you cough up from deep in the lung when you are very sick with TB. It's difficult to produce a good quality sample, and it requires a pretty complex instrumentation to analyze and detect tuberculosis. Therefore, many patients are not really getting the diagnosis where and when they need it. At Find, we're working on 3 approaches to resolve this problem. So TB is an airborne disease. It's transmitted by breath. So imagine if you could capture it in a face mask like this one. You could also imagine a tongue swab on the tongue there, and then you would put it into an instrument, a really portable battery-operated PCR machine. Or you could even imagine a urine-based test, and you would have then a rapid diagnostic tool similar to a pregnancy test or a COVID test, and you would then put your sample on that and really have something that's instrument-free and field-friendly. We're not there yet, but with help from a lot of smart people collaborating with us across the world, we hope we will be there soon.